Hello, I'm Dr. Yung. Recently, lots of mothers ask us whether they should get the COVID-19 vaccine if they are pregnant or breastfeeding. The answer is yes. In Hong Kong, the preferred vaccine for pregnant and breastfeeding women is the mRNA vaccine, which is Comirnaty or BioNTech. The other one, CoronaVac or Sinovac, is also safe. You can get them anytime in your pregnancy, and there is no need to stop breastfeeding after the jab. So these are the two vaccines available in Hong Kong. The Comirnaty or BioNTech vaccine is an mRNA vaccine. The CoronaVac or Sinovac vaccine is an inactivated vaccine. The current evidence of vaccination in breastfeeding and lactating women, most of them are actually on mRNA vaccines. mRNA vaccines have been used in hundreds of thousands of women all around the world already. And so far, the evidence says that mRNA vaccines pose no additional side effects on pregnant women, breastfeeding mothers, or their babies. The resulting antibodies are passed to the babies through the placenta or breast milk to protect the baby. And vaccination during pregnancy can reduce COVID-19 related maternal and neonatal complications. After vaccination, the breast milk actually contains no or only very small amount of vaccine mRNA. So the conclusion is that pregnant women and nursing mothers can safely receive mRNA vaccines such as Comirnaty or the BioNTech vaccine. How about the inactivated vaccine, which is CoronaVac or Sinovac? So far, there's no published safety data in pregnancy and lactation. However, we have been using other inactivated vaccines in pregnancy for quite a long time. So in principle, inactivated whole virus vaccines are considered safe in pregnancy. The World Health Organization has also endorsed its use in pregnant and breastfeeding women in their interim recommendations in January this year. And in February this year, in fact, the Sinovac company has already removed pregnancy and lactation from its contraindication list. And Sinovac's use in pregnant and breastfeeding women is now authorized by the Hong Kong government as well. So, well, that means Sinovac is also safe. So this is the latest interim guideline by the Hong Kong College of Obstetricians and Gynecologists, which is last updated March this year, okay? They say that vaccines are effective in protecting people from serious illness from COVID-19. Pregnant women are at a higher risk of developing severe problems from COVID-19. That includes, for example, increased risk of preterm birth by twofold, and extended perinatal mortality basically means, death of newborn babies by about 50%. And based on the current evidence, they suggest that women who are planning to conceive, are pregnant, or are breastfeeding should be vaccinated with COVID-19 vaccine as the rest of the population, unless they are contraindicated due to underlying medical reasons. And now, the mRNA vaccine, which is Comirnaty or BioNTech, remains as the preferred choice of vaccine for pregnant and lactating women. And you might ask, when should I get the vaccine during pregnancy? We will suggest you to get vaccinated at your earliest opportunity, because we know that COVID-19 infection in pregnancy is more likely to be associated with severe symptoms and other problems in the later part of pregnancy. Therefore, we will recommend you to get the jab early in your first or your second trimester. However, if you're already in your third trimester and you haven't had the jab yet, then you should still be vaccinated to minimize your risk of severe COVID infection. And there is no evidence to suggest that COVID-19 vaccine would increase the risk of miscarriage. However, if you're concerned about the baby's development during the first 12 weeks of pregnancy, you might wish to be vaccinated after 12 weeks of gestation, which we think is also reasonable. And some women also ask us, I already had 2 jabs before I get pregnant. Should I get the 3rd dose, the booster dose? And now, the latest recommendation is that, in fact, you can receive your booster 3 months after completing your first 2 doses. And we know that the antibodies to the virus wane over time after the first 2 doses. And the booster dose is found to be effective in reduce the risk of symptomatic infection as well as severe complications, including death. Therefore, we would recommend you to have the booster dose as well. And we also know that nowadays, pregnant women are offered the Pertussis vaccination during pregnancy. So how should we schedule the 2 vaccines? Now, the COVID-19 vaccines are recommended not to be administered within 14 days of receipt of another vaccine, which means that if you have already got the Pertussis or the COVID vaccine, then please wait for at least 14 days before getting the other vaccine. If you are unsure or if you are struggling with the scheduling, you can talk to your doctor to see how you can schedule the 2 vaccines better. Common side effects from COVID-19 vaccination include pain at the injection site, feeling tired, headache, redness and swelling at the site of injection, muscle pain, and chills. So how can we deal with the side effects of vaccination? First of all, drink enough water, especially if you are running a fever or if you have diarrhea following the vaccine, drink enough water. You might want to take some painkillers or antipyretics. For example, paracetamol is safe in pregnancy as well as for breastfeeding. So you can still continue with breastfeeding after taking paracetamol. For injection site problems, you might want to have some cold compress to relieve the pain, the swelling. If you have a baby at home, you might want to find your family to help with baby care because you might be feeling tired or unwell after the vaccination. But remember, you can continue breastfeeding as usual. There is no need to withhold or to stop breastfeeding at all. Although some mothers may consider to store some breast milk in advance because they may be worried that after the jab, they may be feeling unwell, or some of them may be worried about a transient reduction in the breast milk production, especially if they are unwell or running a fever. Then you might want to store some breast milk first, but that is not a must. Okay, you can still continue your breastfeeding as usual. In summary, COVID-19 vaccines are safe for pregnant and lactating women and their babies. After vaccination, the antibodies are passed to babies through the placenta and the breast milk. In Hong Kong, the mRNA vaccine, which is Comirnaty or BioNTech, remains as the preferred choice of vaccine for pregnant and lactating women. The CoronaVac or Sinovac is also safe in principle. You can get vaccinated anytime during your pregnancy, and there is no need to stop breastfeeding after the vaccination. I hope this information is useful to you and wish you a smooth pregnancy and delivery. Stay safe and get your jab.